You good, Jen? There we go. Hi, everybody. My name is Liza Hewitt, and as Jen said, I'm one of the TA consultants. I see a lot of familiar names, but I also see some new names, which is exciting for us. I wanted to let you know that along with myself, we have Mary Beth LaSalle, Vicki Leandri, and Kim Phillips on the call. They are other TA consultants associated with Race to K project. And so some of you may know them as well. So we're very excited today to do something a little different than we've done in the past. Typically, for those of you who have been on chat calls with us before, you're used to hearing Vicki or Mary Beth or myself asking you the questions and having all of you kind of chime in with what's been going on in your district. And today we're going to change it up a bit, and we've asked two child care administrators in the state who have been living and breathing this to answer some questions for us and hopefully help put some minds at ease that it can be done. It is being done for those of you that are going to be getting ready to go in person. So hopefully we'll get some questions answered from Deb and Teri Ann. So I'm going to start off by asking each of them to introduce themselves and just briefly tell us a little bit about, who they are. I'll start with Teri Ann Cox from the Children's Center in Wolfeboro.
Good afternoon, everyone. Thank you, Liza, and I'm humbled and honored to be part of this today, and I hope that you walk away with some nuggets that will help you have the confidence and the commitment to move forward, because these are incredibly unprecedented times. But as Liza mentioned, I'm Teri Ann Cox. I'm the Executive Director at the Children's Center in Wolfeboro. We are a 45-year-old organization, a nonprofit that is managed by a board of 18 directors. And we serve the community and children from infants, 6 weeks, all the way through a preschool program. And then traditionally, we've also had a before and after school program and a summer program called All Stars, where we also have school-age children with us. So we kind of run the gamut. We are aligned and associated with the Governor Wentworth Regional School District, which has made things interesting as we partner with that school district. But we do serve up to 9 towns. I see one of my team members on the call is Sue Dexter, who's the coordinator for our preschool special needs program. I think that kind of maybe sums it up for now. And Liza and I have been partners in crime as we have been part of the Fostering Footprints collaborative and have been very blessed to be implementing the pyramid model this past several years in conjunction with the school district. So I think with that, Liza, is that enough to say hello?
Sure. Can you just briefly tell us how many children you're currently serving and how many you typically serve?
Absolutely. So we are licensed. Our building is licensed up to 200 total children. Pre-pandemic, we were serving 163 children. Approximately 84, I believe, was our last count as far as preschool. As soon as the pandemic hit, almost overnight, because the schools closed, we stayed open for a couple of weeks, but I was encouraging families to stay at home if they could or find alternative care. And we went from 163 almost overnight. We stair-stepped down in 2 weeks, and then we were at 25 children. So we took a pause, which I know Deb did not, and we closed temporarily, became an emergency childcare program and restructured, and I'll talk more about that. But then we started going back up. We started first serving essential workers' children. And then this summer, we've grown back up to about 60 children. And we are anticipating, as we go back to school, which for us has been pushed out a week, but as of September 14th, it looks like we'll have about 90 children. So we are way down, but we'll talk about how that is really working well for us right now. And but that gives you kind of scope and scale.
Thanks, Teri Ann. Deb, you're up next.
Hi, I'm Deb Hunter. I'm here at the Children's Learning Center at the Cheshire Medical Center, Dartmouth, Hitchcock. So I was enjoying listening to Teri, and I think, and I would love to know how you're doing it also, because this has been such a huge learning experience, and every time I think I've got it, there's something around the corner. So just most important thing is to remember that we are in this together and nobody knows what to really do. So all there are is guidelines, but we're all just, you know, just do the best you can. And also when you're looking at the guidelines, it's so counter everything that we do in childcare that the first, every guideline, the first thing I say is, I can't do this. I can't do this. And that, well, I stopped saying that because it's not that I can't, it's that I have to find a way to do it. So it's not a choice to say I'm not going to do it or I can't do it, because we've been doing it and we will keep doing it. But so our child care center is a little bit different because we are only here for employees of the Cheshire Medical Center or Dartmouth, Dartmouth Hitchcock. So and we're licensed for 125 children, 6 weeks to age 14. So we do have a school age program. When COVID hit, well, right away, like March 6th, we were down more than half of what we typically have. We never have 125 children in here, but typically on a day, if we count after school or before school, we have about 50, and we were down to 20, 25, and then it just gradually got up. And now we're, let's see, today we have 43 children here. And well, I mean, we always serve essential employees anyway. So that was confusing for me at first, why I had to apply to be open. But everybody out there, licensing, Child Care Aware of New Hampshire, like everybody is trying to help. And so that's, everybody's been super helpful. The problem is that information comes out so quickly and changes happen so quickly, it takes everybody a little while to catch up. So we get help, but not necessarily when you have the question, you just have to find the answer. The guidelines are a really good place to start because they do address everything, sort of, just not updated information. Did I miss a question or did I cover it?
No, I think you covered it. Thank you.
I do have my mask. My mask does have to go on if anyone walks in my room. But I think it would be easier for everybody if I don't have it on. But my office is the first office parents see, and so I just have a warning ahead of time if I have to.
You mask it. We completely understand how that goes. And I know Teri Ann has got her mask at hand as well. Teri Ann and I are usually on meetings together with Teri Ann with a mask on, so we get that. So I'm going to jump into some of the questions that we have. The first one is talking about what that transition looked like for the two of you as you moved from what you had been doing the end of February to what you were doing more the middle of March. You know, how did things need to change? How did you prepare families for those changes? What did that look like for your centers? And a little bit maybe too about how you help to prepare your staff for those changes that were coming as well. So families, staff, and transitional changes. Teri Ann?
It's a great question, and I think what helped us was when I did make that decision to close just for a couple of weeks, that really bought me the time. So I don't know how Deb kept going, but what helped was the quick reduction, obviously, in children. And then at the same time, too, we had staff opting out. And luckily, we didn't have more staff than children. But I think some of the key things, we started to look at the guidelines. And we started to first talk about how can we be safe. And so to Deb's point, looking at the universal guidelines, and we said that, we were going to immediately, get started. And let's just talk about the mask. Obviously, we all started wearing masks immediately. And that was something that everyone was not sure about. We were concerned about the children. How were they going to react? So for us, some of the ways we prepared for that, for example, is once we reopened that window, we had links that we shared with parents. We found a social story that kind of came out onto the website that I know, we started sharing with our families. We had the gift of, we have a teacher here who does our music. And Bob, or Bobby Bear, he was doing these online, live shows, if you will, 30 minutes of his music, and the kids would at home view in. And I asked Bob, I said, could you start a song? And he created a song actually about wearing a mask and why we wear a mask and how we're trying to keep people safe. So we did some things like that. We started to the state had a requirement where staff had to go through some professional development. And we talked about the mask issue as an example too, just to have open communication. And there was a lot of concern that children would be afraid or scared, and we did not have that experience. Probably because we had time for families to share social stories. They had time to see Bob singing and having a mask on online. I think what we realized is how critical the voice is, and the eyes. And I'm not saying that, maybe 10 years from now, we'll see some developmental issues on how speech developed, or those kinds of things, but we have been able to still connect at that emotional level with our children. And we haven't had any children afraid or seeing us wearing the mask. That's just a couple of ways that we just, it was like fighting a fire. I'd have to probably even ask Sue, what did we do those 2 or 3 weeks? Because it's a bit of a blur, but we just started to systematically put in place what was required. I'll talk a little bit later. I'll push it over to Deb right now, but there's a pandemic handbook that we wrote. That also, again, we kind of got our communications together, and then through a lot of parent emails, messaging back and forth through our Kinderline ProCare messaging system, to Constant Contact, to Sue Dexter having personal phone calls with her families, to teachers still gathering by way of a Google Meet, to Facebook posts. We just started to systematically communicate back and forth with our families. Here's where we're headed, here's what we're doing, and here's why. And I think taking the time to explain why is something we owe our staff and our families. But Deb, what were some of the things you did?
A lot of the social stories, those were fantastic. And we did the same thing, like we have a private group on Facebook. So I tried to make sure everything was on Facebook. But the same thing happened. Some teachers needed to go, and at the same time, and we lost them all. I mean, March 6th was like D-Day, where so many staff, but also so many children were out, that we just sort of, it was like the bomb went off, and then all of us that were here would just said, okay, what are we going to do? And we just did. The the hard thing is that we know how best to manage change, right? And you know you need all, there are lots of things that need to be in place in order for change to be effective, and we couldn't offer those things because we didn't have all the information. So it was really hard to prepare, because we looked at those guidelines and went through one by one and did everything we could right away on those guidelines, and we used that. But then things kept changing, and so the poor parents, once we told them one system, and then we're like, well, wait a minute, now we have to change. We have to change something else, and then we change something. And same with staff. If it was something that I knew was going to be a change in the system, I would put it out to all staff and to all parents. Like I use Remind for staff, so I would try to put it there. Besides all of the memos and talking with staff that were here, but I guess as we learned more information, things sort of got tighter and tighter and tighter. And so it didn't happen all at once, which was hard and a little bit easier at the same time. Most importantly was making sure staff realized that everything we were doing was to keep them safe, because the staff that had to leave, for the most part, probably half of them had to leave because they suddenly had childcare issues because of the schools closing. The other half were afraid of their own compromising situations, medical conditions or of those sorts. So, and everybody that was here, I mean, I have to be honest, we did feel abandoned, but then we regrouped and we looked at who we had, and then we just did it. And the staff are, amazing. And of course, now staff have come back and children have come back, and we're a little more organized, but still, I mean, the poor parents, they are very grateful that we have stayed open for them. So I haven't had parents complain about very much at all. It's just hard on everybody, because just when you think you know what you have to do, it changes, and then it just is. And I blame COVID. I don't blame anybody else. And when someone tries to blame me, I say, I did not invent this. I didn't. This has nothing to do with me. But the other thing I also need to follow policies that are for Cheshire Medical Center employees. So then there's more rules that would come. Like right away, there was a mask policy for everybody before we even had to do it. The guidelines said, we could, but we had to. So there were things like that I had to maneuver to.
Deb, are your children wearing masks, or
No.
just the staff?
Just staff.
Okay.
A couple of school-age children, well, like one day or here or there, they wanted to, like, okay. But our masks have to be, we can't do cloth masks. We have to wear disposable ones. Parents, when they come in, have to have a new mask on, even if they've just come from the hospital building. They have to put on a new mask. It has to be a disposable one, and they're not allowed to come into the classrooms, but they are allowed in the building. They can come in the hallways, pick up the children at the doors, and then they go out separate. The entrance and the exit have changed. So you come in the same way, but you leave out the back door, sort of.
Okay. So in your situation, the hospital has masks. That's where they're getting their masks. Teri Ann, how does that work for you, the masks?
Yeah, so we had a couple of ways that we obtained masks. We have in Wolfeboro, the Wolfeboro Mask Makers. It's a wonderful quilting group that repurposed themselves, and they've been extraordinary. So we obtained the cloth masks that way. When we took that pause and then we reopened, I reopened and made sure every staff had at least 3 masks to start. Of course, some people go and either have a friend make one, or some people were purchasing masks. We also, as part of the emergency childcare program, received 3 opportunities to go to the state and get some of the surgical masks. Funny quick story. One of the batches we got, the strings keep coming off. So I think we got a bad batch, so that we tried to staple and hot gun glue, and it's been silly. But in the summer months, because it's hotter, we have had a lot of people wearing more of the surgical mask, so that they do that as a disposable. I also was able to find a donor who did a restricted grant, and we did also obtain for all the staff the shields. So the shield is not a replacement for the mask, but in addition, for those that want the added protection, we have provided these to all of our staff as well. Our children do not wear masks, but I'll also tell you that as school goes back, and as some schools are requiring that children wear masks, we are talking about around the 1st of September with our school age program as having those children practice wearing them safely. I mean, these are teachable opportunities for us. We see it as a teaching opportunity. We also have enough of these shields where we've talked about, so we haven't made a decision yet, but maybe providing these to the kids, and then they can decorate them. And then this might be an extra level of protection, because I'll tell you where our fear is starting to go back up. Right now, we've been able to contain people in our bubbles and screen them ourselves, and we have pods where we don't mix. But we're really wondering, how does it work when children do go back to school and then they come back to us in the afternoon? So all adults are required to wear a mask the entire time they're here, and parents, of course, are as well. I've only had 2 parents that have kind of challenged the mask rule, but it's in our policy. And that's the other thing I recommend is, you know, make your center or put it in writing. This is how we're going to roll. This is our policy. In addition to your parent handbook or family handbook that you have from the Children's Center, everyone also has now their pandemic handbook. And we had parents actually sign an agreement that they'd read it and that they will, you know, kind of support the details in there. So that's kind of where we are on masks. I'll also mention quickly, because Deb talked about change and kind of how they flow through the building. When we first reopened, we have a lobby. Parents could come into the lobby. Some centers you'll hear about where the teachers actually go out to the parking lot and get the children. We did have the parents bring children into the lobby, and that's where the screening took place. Screening including asking those quick questions, any symptoms, anything changed since yesterday, and then the thermal temperature check. Both parent or guardian and child are checked before entry into the building. We were then using runners, or teachers would come get the children. And as we went, we stepped up to about 60 children this summer. We didn't have the staffing to continue to do that. So because, you know, we've been really lucky here in the Wolfeboro area, we have adjusted and we've allowed parents just to drop off. And again, kind of like you said, Deb, they flow through the building and they've been so respectful. They've, you know, dropped at the door. They haven't gone into the classrooms. They've used, you know, they have to also take some hand sanitizer as they go. And then afternoon pickup, they pick up from the playground. So all the children are out back and outside, and pickup is outside unless it's pouring rain or 93 degrees like there was yesterday. And then at that point, pickup is in the lobby and the children are brought back up. We are talking about going back to just having parents in the lobby, because your goal is going to be to try to contain, you know, infection or spread. And if you have, you know, in my case, if I have, you know, 90 guardians or parents coming in to drop off 90 children, that's a lot of traffic. So we're going to probably go back if we can figure out how to, you know, get the kids to the classrooms.
Okay. So you are using hand sanitizer and all of that?
Yeah, we installed extra hand sanitizer units, and It's in all the classrooms. I would say though, we're probably, I mean, the parents are the ones really using the hand sanitizer. And of course some of the staff, but really staff and children, I push hand washing, hand washing, hand washing. Children have to wash their hands after they come into the classroom and greet their teacher or teachers. They immediately go and wash their hands, then they play. And you'd be surprised again too. I mean, children, they learn new routines. So that's now part of the routine within our routine within our routine. If, you know, when they go outside and play, as soon as they come in, they wash their hands. So we're doing a lot of hand washing. But yes, we also have the hand sanitizer. We went from 3 hand sanitizers to, I think there are now maybe 6 or 7 on the walls throughout our building.
Thank you. Deb, what does your process look like with the kids coming into the school or into your center, and adults, and how that looks and how it's different than it was before, and who's wearing what?
Yeah. We did try not to have them in the building because that's what the hospital wanted us to do. And we tried it, and it just was, this is what we worked out to be least offensive, I guess, to say, not offensive to the parents, but just like this still, if they're coming into the building, they can still pay their bills, they can still check their mailbox, they can still, and then get to the door where teachers can at least say hi and bye, you know, but it's very different. But they come in, we ask one family in the lobby at the same time. We have a very small lobby, it's more of a foyer. So only one family is allowed in at a time. It might mean people are waiting outside. Lori is the assistant director, so she's here in the morning and she screens everybody coming in. So she takes children's temperature, she asks those questions, and then parents can come in. Parents wash their hands with a sanitizer, and their masks are on, of course. They have to have that before they can come in. And then they drop off at the doors, or we have a designated outside spot if everyone's outside, and they go out the back door. Let's see. I think children wash their hands when they get to the classroom. They're putting their lunch away and washing their hands. And then of course throughout the whole day. And yes, we installed more hand sanitizers. When we started the first day with a sign that said wash your hands as soon as you get in, but then that's when parents were allowed in the room. Then we asked parents not to go in the room. Then we told parents they're not coming in the room. Then we said, no, you're really not going in the room. You're gonna, and I think Teri, you said it, just explaining why we're doing what we're doing. Parents were very understanding. They all work for the hospital. Nobody questioned what the whole hospital was doing, was being ultra careful, because we don't want to have COVID here. We want the least amount of patients with COVID here so that we can handle it all, right? So our goal is all the same, and we want to be able to take care of the children of the hospital workers as long as we possibly can. So far so good. But yeah, so I think that's where we, and I think I keep putting I put signs up, but parents need the reassurance, like we need to keep telling them what to do. I have some parents that stop every day and just say, what's new today? Do you really want to know? Because I'll, here's what I'm working on. But and it took a while. They were like, everywhere you go, there are signs all over the place of how the system goes. And it's really hard to get into a routine. And we know how important that is. So, we just have to train the parents. The signs are up, but I think they're just signed out. Like they just can't. So it's just a lot of counseling parents on what to do.
Have you heard from parents, Deb, about anything that they've done that's been successful at home to prepare their children for the differences that they find in the center now? I mean, this is probably going back a bit. But
We put together like a COVID corner that has resources. Mostly it's those social stories and picture schedules that Pyramid Model Consortium, they put out wonderful things that have been helpful. At first, parents were worried about the masks. It hasn't, children just don't seem to. I think we had one child cry, and it was because we put them on in the middle of the day. Like all of a sudden we were like, we have to wear masks right now, because that was the policy. That's how fast things happen, right? And so one child was like, what? Other than that, we have not had a parent or a child get upset about the masks. We also have to wear shields. Not everyone does, but staff who float from room to room have to wear shields. We worried about how children were going to handle that. They have not. Staff don't they feel like they're shouting but now we've all gotten used to it. Unfortunately, we have gotten used to it. So.
Okay. Are there certain concerns that you hear coming from parents about, having their children there in the program?
The parents that were most concerned about their child getting COVID stopped bringing their children here. That was tough too. I had in the beginning, when parents were trying to figure out what were they going to do, they usually go with grandma. They go with one grandma this day, and the next day they go with a different grandma, and the next day they come here, and they have to have that contact with their grandparents. And I was like, you might want to rethink that, because but they just everybody just needed to talk it out, and we all, and they pulled their children if they really, they just found another way.
Okay.
Lots of parents started working from home. There were just so many different scenarios. The parents that brought the children back are worried, but I'm not sure they're worried about getting COVID as much as they're worried that they're going to miss work because of the illness policy stuff. Because this is outrageous, right? Children are out 10 days with a runny nose. So that's not typical. And so parents are trying to figure out how they're going to manage that.
Right. Teri Ann, what about you? Have you had feedback from parents as far as, concerns about sending their children and how you've been able to manage that, or?
Yeah, I think the same thing as Deb. Parents have had to make some tough choices, and those that have chosen to have their children here have made that choice, and maybe some feel a little pressured because of employment and because they can't work at home, or they they don't have any family in town. But everyone, the bright spot is everyone's so grateful. And grateful that we're doing what we're doing.
Yeah.
I think as far as concerns about the missed work is a big deal. And, just to share kind of what people are going to be needing to prepare for is if you do have potentially a confirmed case, there may be a point in time where you need to close a room or your center just to do deep cleaning, or however the state will step you through that. I made a difficult decision Sunday because we had a potential exposure and a potential, case in one of our toddler classrooms. So I closed on Sunday and communicated that to parents. And I think that was a real wake-up call for all of us. The good news is I can report, we just got back today, that it was negative and that person is recovering, but it impacted, 3 of my staff members and, 9 families. But I keep telling them, and I think one of the best things you can do for families though is to make sure that they don't become so reliant on you. They have to have a backup plan, or they have to know if they need to stay home, will they be able to get EFMLA, or I've had to assure my staff, if you have to stay home, here's, you know, EFMLA, or, you know, how we are going to manage. Just, I mean, people want to get paid, but there will be situations where if there is a confirmed case, there's very clear steps on what the state will do, and the contact tracing. And I think people just need to recognize, kind of like Deb said, it's not our fault. It's not my fault. It's, you know, it's this bad thing called COVID, and our number one job is to keep our staff and our kids safe. And so I, with an abundance of caution, decided to buy that time on my own and make sure that we didn't have a little situation kind of emerging out of one of our toddler rooms. And parents were grateful that I actually made that decision, because they believe that we're trying to make sure the children are safe. And no one seemed put out about it. If anything, like I said, I think it was a wake-up call for us to continue to prepare, and then refocus with my staff on what can you control as an individual. We talked about the 3 W's. Wear a mask, whether you're at work or going to the grocery store. Wash your hands, you know. And the 3rd W is watch your space. And someone I saw in the chat said, how are you doing the social distancing thing? And with little children, you can't necessarily keep them at 6 feet, but what can we do as teachers or educators to provide that distance? There are activities, or there's ways we can reconfigure and pod out activities in our room. We can practice with our school age the airplane as they're standing in line going outside. They don't walk in line like they used to. They're spread out. You know, as an employee, I do not spend more. I never get within 6 feet of a staff member, and I don't spend more than 10 minutes typically with a person either, because, you know, we keep looking at the science. Within 3 feet, Deb, you know this, within 3 feet, more than 10 minutes, it's a whole droplet thing. So how do we prevent that? But, you know, if we keep thinking about what we can control and what we know and how we can prevent, I think we can keep our communities safe, or safer than the way we operated last February. And I think we're going to maybe even have less sickness and flu, because we're being so religious about washing our hands and staying home if we're sick. And we kind of have our gatekeeper. For us, we have a nurse who's actually screening everybody from 6:30 to 8:30, and they know, because she used to work at a kids camp in the summer, and they respect Annie. They know she's a registered nurse, and they know they're not going to bring in their kid and try to sneak her by Annie, because Annie's going to be, why are you bringing in your child who's sick? So I'm actually optimistic, and I just keep trying to go back to what can we control, because there's so much we can't.
Teri Ann, can you you know, one of the things that we've heard from districts that are facing this in-person transition in a couple of weeks are concerns around that social distancing, like actual specifics on what you have done in the classroom. How does that look? How is it different than it was before? What does the environment look like now? Have you had to move tables around? How are you doing circle time? You know, I mean, really, I think that people are looking for nuts and bolts of what is being done in your classrooms. Can you talk a little bit about that?
I can, and I can also say, though, like Deb, we're learning on the fly, and we get something down, and then, you know, we adjust again. But you know, we don't have cafeterias. We have lunch service in the classroom. We provide lunch. Children do not bring their own lunch. So no longer do we have family style dining. And as an example, for lunch, we have spread out the tables and the children. So you may typically see one of our tables with children sitting at each end, or maybe if we used to maybe have 8 children at a table, we now have 4, and we use those dividers, you know, just those cardboard dividers. which again, you think, oh my gosh, you know, the children can't really talk to their friends per se, but we keep the conversation going. We're still doing our, you know, our social conversations. The teachers are talking with the children about their weekends. They're talking about whatever the food is on the plate and healthy eating. So we're still, I think, doing what we always did, but it does look different. We're spread out more. Circle is, you know, bigger. We're spending a lot more time outside. We have not done music, and we don't typically in the summer, but we're not singing in the classroom, but we want to bring that back. So the way we're going to do it is each preschool classroom in the fall, they'll go out with Bob outside. We'll take our yoga mats and spread them out more than 6 feet, and we're going to sing out, you know, he'll sit and we'll do our music outside, because we know outside, you know, transmission is not maybe as bad. When it gets cold or what have you, we've talked about maybe he'll do a live stream and they'll watch him on iPads. So we're trying to innovate or adjust or still keep the essence of what we do in early childcare, but we have had to line up differently, move through the building differently, you know, set up the classroom, spread out the tables differently. Every child now, we don't have bins of crayons. Every child has their own, which is kind of like, I guess we do in 1st and 2nd grade. Everyone has their own little pencil box or little, you know, box of supplies, which that's a huge cost to us. But we, you know, we haven't been able to share markers and those kinds of things. But again, the kids were like, oh, these are my crayons. You know, it's sort of like they have their own little stuff now. They don't have to share. And now we need to make sure that we're teaching sharing, because now they're not fighting over the scissors with the purple handles, that we're trying to help them understand, you know, how to navigate that, because they do have their own stuff. But they've actually, it's been kind of fun for them to have that ownership. Yeah, those are just a couple of the quick things. Deb, what's it looking like for you? The other quick thing I'll say is, and I know someone was thinking about toys. So before we reopened, every teacher went into their room too, and they did cut down the amount of access children had to things. And so we are managing more that turnover of what manipulatives or what children can use. And after they're used, they, you know, we send them through the dishwasher, or we wash them or sanitize them. And so there's areas of rooms maybe that have like little curtains over, which used to be cubbies where they could go get whatever bucket they want. Well, now we have to manage how much access they have to buckets or materials. So the teachers are having to be intentional about that. But again, some of our rooms were way overstuffed. And we know for some children that's too much. Sue would tell you, oh my gosh, there's so much visual stimulation. And so the children maybe that have sensory issues have too much stuff. I think it's actually been a nice balance for us to be more intentional and purposeful about what kind of materials and toys we have available. And then we rotate, and that kind of makes it fun.
Yeah,
Mary Ann, oh, I was just going to ask her one more quick question, then I'm going to let Deb go and answer sort of the slew of overall the environment and the materials. So Teri Ann, how does free play look? So, you know, used to sort of set them free. The materials are on the shelves. They're interacting. They're playing together. How does that look in the COVID world, free play?
We're still doing free play. Again, though, it's a little bit more managed. So instead of maybe 6 options, they now have 3. Again, we have fewer children in the room, so that also I think has been an appropriate reduction. And again, when the teachers can, I mean, they're spacing out, you know, instead of a couple of children working on puzzles together, maybe, you know, they all spread out and they're all working on puzzles together, but everybody has their own puzzle. But I've got to be honest with you. I mean, I see you know, inevitably you're going to have 2 3-year-olds come together that are buddies, and they're going to be trying to problem solve or play with something together. We're honestly, we're allowing that. And then we take the materials, we wash them, and the 2 boys go wash their hands. Outside, again, we're watching how many children are in the sandbox at one time. But I need to be honest, they need to be kids. And so we just keep going back to focusing on washing the hands, washing the hands, washing the hands. So I don't know, Deb, is that kind of your
No,
reality?
that's the same. I was going to say, wow, you guys, that's a lot. I mean, where we can control it, like it's the snack table or lunch, and we can spread them out. But we don't have 6 feet in the toddler room. The tables aren't 6 feet long, so it's not realistic. And the guidelines know that too. The 6 feet is the adults have to be way more aware of 6 feet. Even when we're masked, we're all just sitting farther apart. If we're at lunch together, where our masks are down, we're not close to each other at all. So the adults are the ones who are really keeping 6 feet apart. We're not stopping children from playing with each other. I'm not sure what that would actually look like. I think the reason why masks are not, that they don't recommend masks for the young children, the same reason we really can't keep them 6 feet apart, or even 3 feet for that matter, where they say the masks are going to be it's going to be more to keep those masks on children than it's really worth. It's going against the whole idea. But toys and things, we're sanitizing a lot more. When the children, we sanitize in between, like when they're napping, we'll do the high touch areas. And we like to use the wipes are better, because when you start spraying in locks, you're gonna have a hard time with getting the door open the next time. We found that out. I also broke a copier by spraying. So the wipes are good. And then like Play-Doh, we don't share Play-Doh. Everyone gets their own Play-Doh. Dress up clothes, not so much, but they do play with toys together, and we just clean them at the end of the day really well. We do a lot of spraying at the end of the day, and then we have a cleaner that comes in and does even more cleaning. And then we're just cleaning all the time. Children are washing their hands all the time. They're spreading out at lunchtime. It's not 6 feet, but they are spreading out. And there are a lot less children in the room than we are licensed for, so there's more space for them.
Are you finding that, as you reduce, like in Teri Ann's case, Deb, have you also reduced the number of materials that you're allowing the children to be exposed to, or is it pretty much the same as it's always been?
I think it's pretty much the same from what I've seen, but I'm not in the classroom, so my teachers are doing that. So we all looked at the guidelines, and we all brainstormed, and people are getting ideas from each other about what to do. But there isn't I am not inspecting rooms, nor am I observing to make sure that I trust staff are doing what they can.
Okay. And how are you, Teri Ann touched a little bit on outdoor time, and I know that that you both are trying to spend more time outdoors, which for school districts may or may not be an option, because of course, they're going to have whole schools that are trying to spend more time outdoors. But how are you handling the playground equipment, that kind of thing? Are those being washed down?
But the high touch areas, like the handlebars and things like that, and staff are doing that too. Yeah, and we have to stagger our outdoor times. We are going to get temporary fencing because we have 2 playgrounds that are shared, and they are so now they have to take turns, and we want to put fencing in there temporary fencing so that they can go out anytime.
Are you finding it harder to keep the kids kind of apart outdoors than indoors? Or do you not see that there's really?
I don't know how people are keeping children apart from each other. I'm not. I mean, this is a child care center, so
Right.
so I have to be honest. Also, like Teri said, I mean, that's not. I'm not ever going to a teacher and saying you need to make sure those, separate those two children. I'm not doing that at all. Actually, I'm just grateful that the teacher is here and working with the children. Some children during this, I mean, this is a big change for them. And as we know, children need consistency too. So I have some children that are really struggling. So emotionally, they are really struggling. That I can't keep them apart from each other or the teachers. We just need to keep them safe. So cleaning in between or being sensitive about it. Adults, absolutely. They can be 6 feet from each other but not really the children.
Can you elaborate, Deb? I mean, of course, you're not using names and you're just speaking sort of hypothetically. But can you talk to us a little bit about what you're seeing in children emotionally, and kind of how you're addressing that, or how your staff is addressing that?
Yeah, we're having meetings and virtual meetings, but picture schedules, social stories have been so helpful for us. But just like we would any time a child is struggling, I mean, we're just getting together with the parents and trying to brainstorm how to help this child, and to recognize that it's the consistency that they need, and we can't offer that to them. So what can we offer them, to be consistent? Like, I mean, I had one kiddo who just clearly was having trouble, and Mom and I sat down and we brainstormed 6 feet apart with our masks, and we brainstormed, how could the child's schedule be more consistent, even if the two parents' schedules were not. And so, just like we always do. It's just
Sure.
that I'm really, really worried about, at the end of all this, how children's social emotional well-being is going to be intact. It just, not from what we're doing here or the masks or any of that, just the so much stress for so long. Everybody around them is stressed. I'm worried about that. But there's
Teri Ann, what are you seeing in that realm?
Yeah, I completely agree and echo what Deb has said. We're doing the same things we've always done, as far as trying to, from an intervention standpoint, and having the parent meetings, and the parent involvement is so critical. And as you all know, as you start to go down that path, you discover what's really going on. And so I worry too. I think, that's why we're so committed, and I keep reminding my staff, this is a place of respite for these children, because they can play, and they do feel safe. And that's what drives us, because, we don't really know what environment they're going home to. I think, keep doing those same things and keep engaging those families, and, using those same strategies and tools that we've always used. That doesn't necessarily change. But Deb's right. There's a heightened level of stress. And for us, one of the things that we lost this summer was some of the one-on-one support that we even in the summer try to traditionally put in place, maybe with some children who need that extra support navigating their day. And it could be a child that during the school year has an IEP or what have you. And, it broke my heart, but there was one child who had been home with their grandmother since March. She tried to get back to work this summer, so she brought him back here because this had been where he had grown up. But it's just been the two of them for 4 or 5 months. And then we threw him back into, a classroom, albeit small, with only 5 other children. But he really struggled from a sensory standpoint, from an emotional standpoint, and, was becoming unsafe, bolting, running from the building, trying to escape. And we finally decided that right now he needed a different kind of summer. And he now has a babysitter at home who's taking care of him, because that one-on-one is what he needed. And so, but I couldn't provide that because I didn't have a one-on-one on staff. So, so you're gonna find situations where you feel like, you know, at a loss, but, you know, again, it takes a team, it takes the parents. And I think recognizing sometimes, most of the time, your environment is exactly what that child needs. But maybe, you know, in this case, I had to come to understand that the best thing for that child for this summer was to be able to continue to play in his own backyard like he had with his grandma. And then they're going to have to figure out how to transition, you know, kind of back to school as he transitions to first grade. But yeah, it's stress. And I think my advice to everybody is, when a parent kind of does go off on you, it's not about you. It's about whatever stressors they're probably feeling. And so, you know, sometimes parents will miss a memo and, you know, well, I didn't know that, you didn't tell me. And I'll say, well, you know, we sent that communication home, you know, last Friday, and it's okay, and here's a copy. And, you know, you just keep over communicating, and, you know, just keep being curious and trying to understand and make sure that, you know, you find others to help you through it.
Have you found that that your staff has been spending more time with parents or with families? That communication, has that been more challenging or more necessary through this?
I think for us, it was challenging in the beginning when we didn't let that face-to-face happen of drop-off. So right now we're kind of back in a little honeymoon, because at least parents are seeing teachers face-to-face in the morning at drop-off. We are leveraging technology a lot. We are, through the messaging system that we have with this Kinderline Pro Care, there's a lot more back and forth going on. The staff is working hard to, you know, do just a quick, because that's almost like a text message, you know, Johnny did this today and was a really helpful friend, you know, or take a quick picture and send it to the parents. So we're trying to communicate that way. It's hard because there's not as much face-to-face interaction. And I think we're missing that. I know the staff misses that. And so, you know, they're trying to find ways to fill that gap. I wouldn't say it's more. If anything, it's more purposeful, and it's more organized and less organic. But you know, that's hard because it doesn't feel as emotional. We're in this because we're feelers, right? We're in the feeling kind of relationship business. So that's something to maybe think about, is how can you or your teachers continue to build that relationship with families in an environment where they may not be able to see someone as much face to face, or certainly in, you know, in meetings. We've had, you know, Google Meet or Zoom meetings, and, you know, like this, there's something a little bit missing.
Yeah, I agree. And we struggled with that too. How are we going to communicate to parents? So that was another reason why I really felt strongly that I have to find a way for the parents to be able to come in and at least see the staff every day. In the morning to check in. All the teachers, we changed up all the teachers' schedules so that all the teachers were here at the end of the day, because everybody is siloed. You know, everybody is separate now. So we, so there's at least a connection there, because we're losing so much of the relationship. But parents are being very understanding, and just like you said, Teri, very grateful that we're here. I have not heard very many complaints. I can't even think of the last time a parent complained to me about the care their child was getting, even before COVID, but maybe I'm just not approachable, but I think it's because they ask the questions that well, everyone's worried about the same thing. And so we're all in it together and figuring it out. So I just haven't had any parents really complaining. The ones who were really afraid and found out other ways. Not all of our children came back. Most of them have come back, but not all of them did so far.
Deb, Teri Ann touched a little bit on the singing. Are you singing in your classrooms?
I guess I missed a memo about that not being safe. I haven't noticed whether we're still doing the same thing we did before. I mean, I haven't heard a lot of singing, but yes, we're singing, I think.
Okay. That was just one of the questions that one of the district teachers had asked.
I didn't know that it was,
I think it's just with the particles being more easily spread as their mouths are open and.
Sure. Yeah, that makes sense. They should probably think about
Still
that.
singing in Keene, but not so much in Wolfeboro.
Well, and I should say, we're doing our little morning, our little morning songs and stuff like that. But when we have music with Bob, which does produce more enthusiasm, we're going to bring them outside and
Sure.
spread out and let the kids sing their sandwich song and their mask song and whatever, because he gets them pretty pumped up like a chorus, so.
Teri Ann, is there a way that you have the mask song on video that you might be able to share with us to put in our repository? That was.
Yeah, absolutely. I'll try to figure this out, but for anybody that wants to go, like us on Facebook or what have you, we do have our little Facebook page. And separately, if you're on Facebook, you look for Bobby Bear. Bobby Bear has his own little persona or whatever, but I'll send you a link and again, send you kind of just this song he made up, which was really cute. And again, watching a couple of those episodes, I'll try to figure out exactly, because it's 30 minutes, where it was, so you can try to fast forward. But again, it was whatever you can do for those of you that are concerned about the mask. And I think now children are seeing people wearing masks. So hopefully it's not as scary as it was back in March, but it's just, it's just a fun way. And whether it's the social story or you do it through music, I mean, we all know we learn through story and music. And so I would encourage everybody to kind of leverage some of those ways. But yes, I can link you to that. And your
pandemic handbook, which I know will have different rules than the districts may have, but it may at least give them an idea of what's going into your pandemic handbook.
Yep, I would be more than happy. Just know, and the latest update was as late as August 11th, because we included how we're going to charge families, if they have to not be here. But yeah, absolutely. I can share that, whatever resources
we love not having to reinvent the wheel if we don't need to. So anything that can be sent along. So for all of you, that will be in the repository under the resources section. So Deb and Teri Ann, if you could tell us, if I ask this question, what's the biggest challenge that you found? I'm looking for one biggest challenge.
I can answer that. I mean, for me, it's staying updated on the latest. I mean, things get updated, and I struggle with who do I listen to? The CDC. If the CDC makes a change, do I go with them? Do I wait for the hospital do I go with the infection preventionists at the hospital, or do I go with New Hampshire Public Health? Or how to know when something changes. That's the toughest part. There's a lag every time, and you got to take everything case by case. Like when each child, I mean, each family has a different situation, right? Whether they've traveled or not traveled, or exposures, or symptoms or not symptomatic. it gets so confusing. I mean, I made myself charts, but then something changes, and so that's the hardest part for me. It's keeping up with the change.
And to piggyback on that, Deb, what is your current, in a nutshell, what does the policy look like for you around sickness and how that's handled in the center with kids?
So, so the CDC changed or added to their list of symptoms. And so I updated our illness policy so that it has all of those symptoms, including the runny nose. Again, this goes against all of us know that all children in childcare have a runny nose at one time or another. It's been very difficult to define what a runny nose is. But we kind of, it's case by case. You know when you see it, if this child is sick, they will be excluded. So they're excluded at this point. They're excluded for 10 days at least from the onset of whatever symptom it is, and 24 hours after they are symptom free without reducing medicine or any medicine for the symptom. So it used to be 72 hours. It's changed a lot, but now it's 10 days and 24 hours. Unless it's proven not to be COVID.
Okay.
So today, if they get tested and it's negative, they can come back 24 hours after they have no symptoms, of course. Mm-hmm. If the doctor writes a note, then good for you for getting a doctor's note. But if a doctor writes a note saying this is not COVID, then it's not COVID. They can come back 24 hours after they're symptom free. But I believe that that's changing. I believe that the negative test is not going to. Some doctors have now refused to have the child tested because a negative test doesn't prove anything. So they are saying they're going to be out for 10 days anyway.
Yeah, and that's the thing that's so frustrating is, we're dealing with pediatricians. With all due respect, I'm not one, but you are going to see a variety of decisions coming from whether the CDC is going to be different than DHHS, which is going to be different than what maybe your school system says, which is different. We've got Wolfeboro piece, but they're different from Lilac. So if you are, your own center, making sure that you're, again, updating your policies and trying to be consistent. But then, like Deb said, you also will probably know your children. And we've got really bad runny noses right now with all the hay fever and the goldenrod. And when we know a child is taking allergy medicine to try to stop the runny nose, and we've got that kind of on record from a doctor's standpoint, we are on the runny nose thing anyway, Deb, we're being a little bit more lenient on that one, where fever, absolutely not, coughing, absolutely not. I mean, we're following absolutely what even the CDC is, recommending. And that's what parents have a hard time too, because in a lot of these cases, it used to be 24 hours after, not having any fever reducing medications. And right now we're holding at the 72 hours. So you're going to have to help parents understand that. And I've been part of a leadership forum, and some centers, their policy is they're not letting the doctor's note override because there's so much inconsistency with the doctor's note. So they're saying you've got to get tested, or so it's kind of a bit of a Wild West terrain out there. And I think, unfortunately, every symptom that's on the list, are very typical for us. And I think what I dread is as we get into flu season and cold season, it's going to be really hard to navigate, some of this. So I agree. I think that's one of the hardest things, is keeping up with how things are shifting and changing. For me, it's also, I worry about my staff's capacity and my capacity. So how how can you know that this is a marathon, and how can you put some kind of breaks, or, I've been trying to, take some time on Fridays, for example, or, I mean, how do you protect your capacity to produce and keep moving through this? And it's really hard right now because, and I don't want my staff to burn out. So thinking about that, thinking about the mental health of your own team, giving them permission. And that's one of the things, our ratios typically for 8 children, you would have 1 teacher. Well, we have 2 teachers with every pod of 8 children. And so they do know that they're building relationship with each other. And if one of those teachers needs to step away into the hall just to take off their mask for a minute because they're feeling anxiety or what have you, that's okay. So where can you give your staff permission to take a break? Which is really difficult because they can't go into each other's rooms. So how can you build in supports so that, you've got your staff there with you come next March? But that's what's really hard right now, is keeping everybody up. And they will look to you and they look to Deb, I know, for the tone. And I know if I'm having a moment, I will close my door because I don't want them, if I'm down and discouraged and I don't think I can get through the day, they're going to see that and that's going to bring them down. So it's really important as leaders for us to think about our own wellness.
I agree, Teri. And then sometimes sometimes I let them see my stress because they know I'm taking this very seriously, and that there's a lot of stuff I'm going through for them. I mean, like when they ask if there's a better shield for their, I want them to know I'm gonna look for the best shield. If there's a better one out there, they hear about it. Let me see what I can do. So I'm sort of fighting for them, not really behind the scenes, but so they know that I'm sure they know that with you too, but that at least I can take that away from them, all that other, because and even down to the illness policy, the staff nobody wants to call the parent and say they have to go home, right? Because we all know that it could be prolonged, right? Because we told the parents that. So I say, you call the parent, but send them to me about when they're going to come back. And teacher's like, I don't want to call the parent. Can't you call them? I'm like, you. All you have to do is tell them that what the symptoms are, that they're sick. I'm the one who's going to give the news of it's going to be 10 days, 14 days, 10, whatever. Yep. Whatever it is that day. So we'll do it together, but it's a lot. And I want to worry about that too, because it is prolonged. We don't know when this is going to end and how much longer can we go. But everybody, we've been very fortunate.
Yeah.
So have there been bright spots? And can you give me an example of a bright spot? Or if you have more than one, you can give me examples of more than one. Feel free. But can you pull up one that will kind of encourage this group as they go forth and think about going in person in their districts as school begins to come back together? Teri Ann, you're always good for me with a bright spot.
Yeah, I mean, again, we are fortunate in this state. We haven't experienced what they're experiencing in Florida, as an example, or New York City. So I think the level of gratitude that the parents have to us, and I think, again, we've chosen to do this work, whether it's in a district or in Wolfeboro or up in Lebanon, and the bright spots are those kids every day. You're going to hear laughter. You're going to hear children at play. You're going to hear them and you're going to see them develop. Everyone's so afraid everyone's going to fall behind. And I wonder about my own teenage son, but we're moving through this together. And, for me to hear that laughter and to, I can't go in and hug that child, but I can tell them I love them, and I think they have a really cool shirt on today. And we can help these children become their best little selves that they're going to be just by, you know, by being with them. And so I think go back to your mission and go back to why you're doing what you're doing. For me, that's a huge bright spot. And everybody on this call today, you know, you're my heroes because you're having a significant, meaningful difference in the lives of children. And so to me, that's just, I don't know, I'm sorry. That's a bright spot. Is that good?
That's great, Teri Ann.
Very
Deb,
good.
how about you?
This has been an incredibly bonding experience for everybody who's gone through it. I mean, I feel much closer to all the parents and staff. Like, we're surviving this. This is epic, right? As hard as it is, it's still we're doing really well, and everybody appreciates that and knows that, and so that's a bright spot. I also think at the end of this, when we're all done with this and we go back to our regular illness policy, I'm going to have no problem telling a parent they have to be out for 24 hours. Like, I used to get complaints about that all the time. Nobody is going to, this is going to make that so much easier. So that's another bright spot.
All right. Jen, I'm going to turn it over to you to see what you've got for us in closing up. And
I do want to first acknowledge that the atmosphere right now around school opening is tenuous at best, and that that all of us may not be experiencing the gratitude that both Teri Ann and Deborah are feeling, and that the anxiety around opening schools is high. I think it's important to acknowledge that piece of it, and that district-run preschool programs, there's some unique challenges that kind of became apparent as they were talking. For some of our programs, there aren't space requirements, there aren't requirements around bathrooms, there aren't requirements around sinks in your classrooms, which cause unique challenges that because there are regulations that oversee some of the programs in the community, they haven't had to address, that you will all have to address. And I think that what sort of jumped out at me, and also many of you are, it's not about going to be, many of you are being held to reopening plans for your buildings, for your district, that may not have taken into consideration the unique needs of early childhood and young children. And so that makes it that much more difficult. But what we try to do here at Race to K is bring opportunities together for people to hear ideas and to connect with one another, because there isn't a forum that exists for preschool folks to talk about what they're doing and how they're doing it, and to share ideas. But perhaps the one overarching thing that is really sticking out to me that both Teri Ann and Deb said was that they control what they can control. And that might sort of be the biggest or best piece of advice that I think I heard today, is that there are a lot of uncontrollables and unknowns in this situation, but really taking it to the question of, so we have to do X, that's the guidance from the district. What parts can we control about this, and tackling it from that standpoint, that really sort of hit home. And I also think that the discussion around self-care and being aware of other staff members' anxiety is really important, that while we're looking out for our children and our students and our kids' well-being, that we're also thinking about how we can support one another, because research has shown that prolonged exposure to stress, and this is certainly an extremely stressful situation, is harmful all around. And so really sort of thinking about that. I will say my wheels are working, as I'm sure Liza, Mary Beth, and Vicky's wheels are working, about what might come next from this discussion, and some places we can go. I want to thank Teri Ann and Deb for being willing to talk about their experiences and share their resources with us, because Liza said we don't like to recreate the wheel. So if you have something that people can borrow from as a starting point, that's really great. Because I can tell you that, you know, a lot of people, including myself, are sort of like, where do you start when you have reopening and everything is turned on its head? So I appreciate you guys taking the time to share your expertise with us, and your honest assessment of how you're handling things. There were a couple questions about air purity that came up. I'm curious if either one of you have any air purity processes, or if it's just as is.
About a year ago, we did have our air quality tested, and we did just change out one of our cooling units. So we're moving in the right direction. We have right now, of course, when it's really hot, but I have pushed to have windows open a lot, just to keep that nice circulation. They don't advise, Deb, I think, not to necessarily use fans per se, but to have those, you know, the windows open and the fresh air coming in, you know, is really important, especially first thing in the morning. You know, we've done that, but that's something, I mean, we're a nonprofit that doesn't have some of the district or maybe even hospital resources, but it's something that on another topic, our joint loss committee with the staff, it's something that we're exploring and looking into, and maybe even seeing, you know, should we get, I know some of the hospital in their rooms or what, they have those little air purifiers. You know, we're looking at, should we investigate trying to provide some of those, or at least one in our lobby area where there's quite a bit of traffic. But I know there's a lot of talk about that right now. But for us, we need to solve that before December. But for us, we've really leaned into open window policy and being outside as much as we can.
I'm going to have to ask because I don't know what I mean, of course, we try to get outside as much as possible, but I don't know anything about, we don't have fans, we have air conditioning, so I'm not sure.
And thank you both for answering questions in the chat too. I appreciate that. You make my job a lot easier. So I'm conscientious of the time, and it's 4:43. So I want to thank everyone for taking their time to join us today, and be on the lookout. I feel pretty confident we're going to do some follow-ups to this, and have some additional opportunities for people to talk with one another. I hope everyone found it helpful. I hope as well Deb and Teri Ann found it helpful to be able to share and hear from each other what each other was doing. Hopefully that was helpful. And thank you all for participating, and fill out your evaluation. Have a great afternoon, everyone.
Teri, it was nice to meet you.